Namaste, welcome to the Science Podcast. Today's topic is the situation of sexual and reproductive health SRHR for people with disabilities. I am Prajwal Subedi. I am a national facilitator or core member of Working Group with Disabilities and 2030 Agenda and board member of ypeerap Nepal. Today's discussion is focused on teenage pregnancy and peer education. I am here with a special guest. His name is Ghan Bahadur, who is also a national facilitator in Nepal. Welcome to the show.
Namaste. Thank you very much. I am here to present on the show and I appreciate it. Looking at this situation, teenage pregnancy and peer education are extremely important issues for deaf people. The challenges faced by young individuals still exist. Many are getting married and pregnant at an early age, and this issue is prevalent throughout the country. The lack of knowledge is the main reason for this, as there is a lack of proper education, no peer education, and limited access to learning. This leads to a lack of awareness and fewer education opportunities, contributing to the ongoing challenges.
You have raised a very important point. You are more familiar with deaf people and people with disabilities in general. Now, considering the situation of young people and teenage pregnancy, along with the challenge they face, what are your thoughts on this? Please share more about your perspective.
Thank you for your question. Currently, this is a big issue in Nepal because SRHR, sexual and reproductive health and rights, education in schools is still very limited. Moreover, the knowledge and awareness that this education should provide is not very impactful. While many hearing schools teach about SRHR and teenage pregnancy, which helps create some awareness, deaf people do not have more access to such education. This is a significant global issue as well because the availability of interpreters is very limited and communication barriers lead to many deaf individuals being left out and suffering. The lack of SRHR education for deaf people and people with disabilities is a major challenge. In this area, there are not enough active efforts to address the issue.
Yes, this is a worrying or very difficult situation. What barriers or safety do young people with disability face when it comes to preventing teenage pregnancy?
Thank you for this question. In Nepal, when we look at the situation, there is often a negative mindset rather than a positive one. People with disabilities and deaf people can be active in SRHR, but when people think of disabilities, they automatically have a negative mindset. This is a major societal issue. They think that we too may not be able to hear and actively work, but we can still contribute to the world. We can also actively engage in SRHR discussions. This negative mindset has a significant impact and the challenge still exists. The thinking has not changed much. The old mindset is still there. People still question how people with disabilities can develop, and this outdated thinking is a major challenge part of the problem.
How do you think we can address and solve the various challenges and barriers faced by the deaf individuals and people with disabilities while ensuring that young people with the disability have access to accurate information?
For the question, in Nepal, from ypeerap Nepal, there have been some initiatives such as peer education, learning programs, and community-based education. Deaf people and people with disabilities can also learn through these methods. When they learn about SRHR and sexual education, they can share what they have learned and create awareness, which has a positive impact. This was not happening before, but now, sharing this growing experience in peer education, many are actively engaging. Peer education is also gaining momentum and is very important in raising awareness.
That lack of information also puts young people with disabilities at high risk of unintended pregnancy and STI, right?
Thank you for the question. When I was in school, one of my friends who was still in a lower class than me suddenly became pregnant. At first, her belly started to grow and she went for medical checkups, but she did not have the knowledge of how to stay safe or how to manage pregnancy or abortion. She did not know how to eat nutritious food or take care of her health. When she gave birth, it was a huge issue because she was not prepared for it. If she had the knowledge of how to stay safe during pregnancy, how to eat well, and how to take care of her child's growth, things might have been different. But she did not receive that education. As a result, she went through immense pain and struggles. After her child was born, her life changed drastically. She was expelled from the deaf school, faced rejection from her family, and ultimately lost her life. Looking back, I understand her pain more deeply, and it reinforces the importance of ensuring deaf young people receive the right education and support.
Yes, that's true. What is peer education and why is it important? How can we support it? Could you elaborate on this further?
Thank you for the question. Peer education is extremely important to this time, just like we do. Peer refers to people who are of a similar age group or share similar experiences. It's not about a significant age difference. Peer education involves learning from each other and sharing experiences openly. When younger people or those of the same age group learn something, they can exchange their experiences and share it with others. When people are older, they might not always absorb or share their knowledge as freely, but peer education is more effective because it's about mutual communication, talking, and learning from each other. For instance, if two people of the same age group talk about something they have learned, they are more likely to engage with it actively. They can teach and learn together, which helps in understanding and retaining the information better. Peer education can also overcome barriers where traditional teachers might not be as approachable for young people. Since they are sharing with peers, the learning process becomes more open and there is more involvement. This method can be a great way to support each other for youths with disabilities in the country, and it can bring about positive change in the current situation, and peer education is important.
In your opinion, what qualities should a peer educator have? What can be done to ensure that young people with disabilities have access to the information and resources they need?
Thank you again for the question. Peer education and being a peer facilitator are extremely important. It means understanding from the heart, actively participating, sharing knowledge, exchanging experiences, and teaching others. For example, persons with disabilities can also become self-reliant. When we continuously teach them, they can become independent. Through quality education, using signs when needed, and openly communicating through sign language, we can share knowledge effectively. If we teach through peer education, they will also learn and grow. Peer education, that person will also do well. This is very important at the moment.
It is really good. What other strategies would you recommend to support young people with disabilities in preventing teenage pregnancy?
Thank you again. I have been thinking about teenage pregnancy, its prevention, and the need for peer education. First, peer education, disability-friendly or deaf-friendly approaches, and trained teachers in deaf schools are essential for raising awareness and providing guidance. To ensure safety and awareness, teachers must understand these issues as well. Creating videos in sign language or displaying informative posters can be effective ways to educate students with disabilities. When thinking about searching for information on teenage pregnancy, there are very few dedicated sources, research materials, videos, books, or other accessible resources available. This lack of information is a major issue. People often discuss the topic in different ways, leading to misunderstandings. If more resources were created, it would help in identifying challenges and addressing teenage pregnancy more effectively, making easy solutions more accessible.
That's a great suggestion. Peer education is a valuable approach. Can you elaborate on how peer education program can be designed to be more inclusive and effective?
That's a great question. Peer education is highly effective because it can be implemented in various contexts. Through peer education, teachers, facilitators, and knowledgeable individuals can share information in an engaging and interactive way. For effective implementation, training programs should be conducted for healthcare workers and other professionals. Educational discussions should be encouraged and learning materials should be developed in an accessible and user-friendly format. It is essential to ensure inclusivity by providing interpretation services, making infrastructure more disability-friendly, and managing sign language interpreters in physical settings. If this could be done, the situation would improve significantly.
Your ideas are very good. What can policymakers do to support these efforts?
Thank you for asking a great question. The involvement of policymakers in creating inclusive policies is crucial. They play a key role in ensuring that education is accessible to all, especially for people with disabilities. To make schools more inclusive and disability-friendly, policies must prioritize accessibility, appropriate learning materials, and support services for students with disabilities. Peer education or learning from friends should be included in educational programs. However, such programs have not been widely implemented yet. Including peer education in school curriculum could be very effective in influencing behavior, but there is no mandatory structure for it at the moment. If such an approach were adopted, it would be highly beneficial. That's why some people may say it's no longer necessary, but this is actually a very mandatory and important issue. If it were included in the policy, it would make things much easier for persons with disabilities.
Those are great recommendations. Thank you for sharing your insight and experience. This has been important conversation.
Thank you as well for giving me the opportunity to speak and share. It was a great experience to express my thoughts. Regarding how to bring about change in such situation in the future, sharing and open conversation are key. Indeed, in the coming days, there can be more efforts to build continuity through disability-friendly education and a peer education environment. Your expectations are valid, and creating an ongoing supportive space for these initiatives can lead to lasting positive changes. I hope for this to happen.
Thank you for your valuable time, your sharing and everything you have contributed. I truly appreciate it. Join us next time as we discuss stigma and discrimination in accessing SRHR service. Until then, thank you for listening. Thank you very much for your valuable time and for sharing your experience and insights so clearly in this podcast. Now let's move on to the some myth and fact question and answer. I'm excited to have game for you. Welcome to the show. Being curious, let's start with myth and facts.
Now another question. I will ask you a question about myth and fact. Can peer education help in solving the issues of individuals, such as preventing pregnancy?
Yes, it's a fact. Our peer education is important because it teaches students, helps develop knowledge and provide support which can help in solving problem. You listen, thank you. Thank you for your time and for sharing your valuable thoughts. I appreciate the opportunity to engage in this conversation. I would like to give this as a small gift for you.
Thank you. Sign applause.